Hello, and welcome. Today we're diving into a specific type of pleural effusion called eosinophilic pleural effusion, or EP. We'll explore what it is, what causes it, and how it's managed. So, let's get started. Eosinophilic pleural effusion isn't a disease itself, but rather a condition where the pleural fluid, the fluid surrounding the lungs, contains a high number of eosinophils. These are a type of white blood cell that typically fights off parasites and is involved in allergic reactions. The causes of EP are diverse. The most common causes include parasitic infections, drug reactions, pneumothorax, asbestosis, and malignancies. Other possible causes include fungal infections, hypersensitivity reactions, and in rare cases idiopathic EP. Sometimes, the underlying cause remains unknown, which is referred to as idiopathic eosinophilic pleural effusion. To understand EPE, we need to look at the underlying pathophysiology. When the pleura is irritated or inflamed, it can lead to an influx of cells and fluid into the pleural space. In the case of EPE, the presence of eosinophils suggests an immune-mediated or inflammatory process. The exact mechanisms leading to eosinophil recruitment are complex and can vary depending on the underlying cause. For example, in parasitic infections, the parasite itself or its byproducts can directly stimulate eosinophil production and migration. In other cases, the trigger can be an allergic response or exposure to a substance like asbestos. This influx of fluid and cells, especially eosinophils, into the pleural space is what we detect as an eosinophilic pleural effusion. Epidemiologically, eosinophilic pleural effusion is relatively rare, and precise statistics on its prevalence are limited. However, it's important to remember that EP is a finding, not a diagnosis. Therefore, its incidence is linked to the frequency of its underlying causes. Factors like geographic location, exposure to certain environmental substances, and the prevalence of parasitic infections can all influence the likelihood of encountering EPE. For example, areas with higher rates of parasitic infections will likely see more EP cases related to those infections. The signs and symptoms of eosinophilic pleural effusion are often related to the underlying cause of the effusion, as well as the effusion itself. Common symptoms include shortness of breath, chest pain that worsens with breathing, and a cough. Depending on the amount of fluid accumulation, individuals might also experience fever, fatigue, or weight loss. If the underlying cause is a parasitic infection, there may be symptoms related to that specific infection, such as abdominal pain or diarrhea. It's important to note that some individuals may have EP without experiencing any noticeable symptoms, particularly if the effusion is small. Diagnosing eosinophilic pleural effusion typically involves a combination of imaging studies and fluid analysis. Chest X-rays or CT scans can help visualize the pleural effusion. However, to confirm the presence of eosinophils, a thoracentesis is performed. This involves inserting a needle into the pleural space to collect fluid for analysis. The fluid is then examined under a microscope to count the number of eosinophils. Generally, an eosinophil count of greater than 10% of the total white blood cell count in the pleural fluid is considered diagnostic for eosinophilic pleural effusion. Further investigations are then conducted to determine the underlying cause of the effusion, which may include blood tests, sputum cultures, or even a pleural biopsy. While there aren't specific classifications or types of eosinophilic pleural effusion in the same way there are for some diseases, it's helpful to categorize EPE based on its underlying etiology. For instance, we can classify EP as being caused by parasitic infection, drug reaction, malignancy, or idiopathic, meaning of unknown cause. This etiological classification is crucial as it directly informs the subsequent treatment strategy. Identifying the specific cause is paramount for effective management. The treatment and management of eosinophilic pleural effusion are primarily focused on addressing the underlying cause. For example, if the EP is caused by a parasitic infection, anti-parasitic medications will be prescribed. If it's a drug reaction, the offending drug should be discontinued. In cases where malignancy is suspected, further investigations and treatment, such as chemotherapy or radiation therapy, may be necessary. In addition to treating the underlying cause, symptomatic relief may be provided through thoracentesis to drain the pleural fluid and alleviate shortness of breath. In some cases, corticosteroids might be considered to reduce inflammation. Since eosinophilic pleural effusion is usually secondary to another condition, prevention is focused on avoiding or managing the underlying risk factors. This might include practicing good hygiene to prevent parasitic infections, being aware of potential drug reactions, and taking appropriate precautions to minimize exposure to environmental substances like asbestos. Regular check-ups with your doctor can also help detect and manage conditions that could potentially lead to EPE. The prognosis for eosinophilic pleural effusion largely depends on the underlying cause and the effectiveness of the treatment. In many cases, if the underlying cause is identified and treated appropriately, the effusion can resolve completely, and the prognosis is generally good. However, if the underlying cause is difficult to treat or remains unknown, the effusion may persist or recur. Current research is focusing on better understanding the mechanisms involved in eosinophil recruitment to the pleura and identifying novel therapeutic targets. This includes research into the role of specific cytokines and chemokines in the development of EPE. Newer imaging techniques are also being explored to improve the diagnosis and monitoring of pleural effusions.